take you to Atlanta, where the CDC is now holding that briefing on Ebola that's just now getting underway. Let's listen in.
Thank you very much, everybody. Thank you for joining us today. Today is the 5th day after the diagnosis of the first Ebola case in the United States, and we wanted to update on what has been done, what is happening in Atlanta on the ground, and also address questions that have been arising and answer questions that you may have. The first case of Ebola is obviously both scary and unprecedented. Ebola is a deadly disease, and we know that the images from Africa remind us all of the severity that Ebola can cause in a community. Everything we've seen until now reinforces what we've known for the past 40 years. We know how to stop outbreaks of Ebola. In this country, we have healthcare infection control and public health systems that are tried and true and will stop before there's any widespread transmission. The core of that, the way to stop Ebola in its tracks, is contact tracing and follow-up. And I really want to salute the folks in Texas who are doing a phenomenal job of organizing their response, addressing this unprecedented situation, working in a highly structured, highly efficient and effective way, and addressing the needs of the patient, the contacts, and the community. It is wonderful to be working with them, and we value the partnership greatly. At this point, we've been saying for a couple of days that we're in the process of assessing contacts. And let me be really clear about what that involves, because in public health, we do contact tracing all the time, every day around the year, whether it's for tuberculosis or a sexually transmitted disease or meningitis or measles or other things. It's core activity for us in public health. And in contact tracing, we expect that there will be some adjustments, some changes from day to day. The numbers may shift by 1 or 2 from one day to the next, as further interviews may identify that someone thought they had a contact and didn't, or someone may remember that they had a contact that wasn't initially remembered. But at this point, we'll give you information about what we know as of today, and going forward each day we will update that information. We will always have the fundamental principle that we will share with you any information that we have that you may need to know and that may be relevant for understanding the outbreak and our response to it. So as of today, or as of yesterday, I'll say, because today happens hour by hour and minute by minute. So we'll give you the information as of the end of the day yesterday. We had assessed 114 people who may or may not have had exposure to the patient. We've done the assessments in all 114, but there's still a couple where we're sorting out whether or not they are actual contacts. At this point, we have identified, in conjunction with folks on the ground in Texas, 9 individuals who we're pretty sure are definite contacts with the source patient, with the index case, as we refer to him. That includes family members as well as some people in the healthcare profession. In addition, there are about 40 other people, and the numbers may change by 1 or 2 per day, that we can't rule out had contact. We don't know that they had contact, but because we're not certain that they did not have contact, we will be monitoring them as well. As of yesterday, that number total was 46, and we had been able to reach and monitor the temperatures of all but 1 of those 46. All were normal, all were healthy. All of the 9 who had definite contact we were able to reach. So we are confident that none of those with definite contact had any symptoms related to Ebola. None of them had fever. We'll be watching that very closely, particularly for those 9 individuals in the coming days, understanding that the peak period after exposure is about 8 to 10 days, but it can be as long as 21 days. So for up to 21 days after exposure, we will be monitoring all of those roughly 50 people and any others if we identify other contacts, and providing the information daily on the proportion that we have reached and the status of any individuals and whether or not they are ill. That group of 50 does include some individuals who traveled in the ambulance after the index patient. And when we reviewed with the ambulance staff all of the details there, we couldn't be 100% certain that other people in that ambulance may not, subsequently other patients may not have been exposed. And therefore, those individuals, although they're not considered to be definite contacts, will also be monitored for the 21-day period. In addition to contact tracing, I just want to mention two other issues before turning it over to our colleagues in Texas. First, the issue of other cases in the U.S. As we anticipated, the arrival of the first Ebola patient in the U.S. has really increased attention to what health workers need to do in this country to be alert and ensure that a travel history is taken, and that if people have fever and a travel history or other symptoms that are consistent with Ebola, and that travel history is very specific, were you in these 3 West African countries in the past 21 days? And in that case, we would, of course, do rapid testing. If that testing is negative, we actually repeat the test if it's a high-risk patient or a high-probability patient after 72 hours, unless it's become clear that that's not their illness, because it can take 72 hours for someone who's being tested to test positive. We have already gotten well over 100 inquiries of possible patients. We've assessed every one of those with state and local health departments, with local health departments and hospitals, and just this one patient has tested positive. We've helped a dozen laboratories around the U.S. do high-quality Ebola testing so that that testing doesn't all have to come to us here at CDC, and it can be done more rapidly locally, as is being done in Austin, Texas. And we expect that we will see more rumors or concerns or possibilities of cases. Until there is a positive laboratory test, that is what they are, rumors and concerns. And in fact, we want to see more concern, but we want that to be appropriate. We want the concern to be for someone who has symptoms, fever, and who has traveled to Guinea, Sierra Leone, or Liberia in the last 21 days. We're also looking at this point at some people from Nigeria, but we think really transmission there in the 2 cities that had transmission has ended. In addition, I know there have been a lot of concerns about the process of monitoring people when they come into this country. And I just want to make a couple of key points about that. The first is that our number one priority is the safety of Americans. Full stop. Second, that we need to look at different suggestions that are being made. And we've seen a lot of suggestions made in the media, by the public, by members of Congress, and we're going to take a hard look at that, and we're quite open to seeing what can be done to ensure that if there are ways to reduce the risk, we implement them and implement them well. We also, I do believe, have to recognize that we are all connected. And although we might wish we could seal ourselves off from the world, there are Americans who have the right of return. There are many other people who have the right to enter into this country. And that we're not going to be able to get to zero risk, no matter what we do, unless and until we control the outbreak in West Africa. And that's what we're working very intensively to do. And we're beginning to see some progress there, but it's going to be a long, hard road. And finally, in terms of the entry process, we really need to be clear that we don't inadvertently increase the risk to people in this country by making it harder for us to respond to the needs in those countries, by making it harder for us to get assistance in, and therefore those outbreaks would become worse, go on longer, and paradoxically, something that we did to try to protect ourselves might actually increase our risk. And I'll end with just one example along those lines from the time that I was in Liberia. The African Union is quite willing to send hundreds of health workers in to help fight the outbreak in these countries. And they today have folks on the ground caring for patients. And that's a terrific development. But their ability to get there was delayed by about a week because their flight was canceled and they were stuck in a neighboring country. So that neighboring country had taken, Senegal, had taken that action in order to try to protect themselves, stopping all flights, but in fact, that action ended up making it harder to stop the outbreak in Liberia and elsewhere, and potentially increased the risk to that country. So number one is to protect Americans, but not to do things that might inadvertently make it harder to protect Americans. So I'll stop there, and Barbara Reynolds will introduce the next speakers.
Thank you, Dr. Frieden. Our next speaker is Dr. David Lakey, who is the Commissioner of the Texas Department of State Health Services. Dr. Lakey.
Thank you, and thank you, Dr. Frieden. First, as I begin, our thoughts and prayers really are with the patient right now and his family. Obviously going through a very rough situation right now, and our prayers are with him. And also our thoughts and prayers are with everyone that has been identified as a possible contact. Obviously, a lot of concern there, and making sure that we're working with the individuals and giving them the care that they need. We're working hard in Dallas to handle issues here on the ground and to keep people informed. Obviously, a lot of interest, heavy interest in every detail.
We're going to break away from that news conference now that's taking place in Atlanta. You have heard from the head of the CDC the update about what's being done to deal with this Ebola emergency that's been taking place in our country, with the first diagnosed case that was found in Dallas, and the steps to protect other people who may have come in contact with that individual. We are hearing that 9 people are the people that they're focusing on. They're not showing any real symptoms, have no fever, so they're keeping close watch on 9 particular people who had direct contact with Thomas Eric Duncan, who is the patient that is being treated in Dallas at this time. So we're going to keep close watch on the developments from that news conference. If there's any other news to bring you from that conference, we will bring that to you.